This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dytor E 20mg Combi Kit is a combination medication designed for adults managing high blood pressure and edema due to heart failure. It contains eplerenone and torsemide, both of which serve essential functions in fluid regulation. Indications and uses. This medication is indicated for the management of persistently elevated blood pressure and to alleviate edema associated with heart failure. By acting on specific receptors in the body, it helps to reduce excess fluid retention and control blood pressure levels effectively. How it works. Eplerenone works by blocking aldosterone, reducing sodium and water reabsorption, while torsemide promotes the excretion of sodium, chloride, and water through the kidneys. Directions for use. It is important to take the medication as prescribed by your physician. Swallow the tablet with a full glass of water without crushing or chewing it. Your doctor will determine the appropriate dosage and length of treatment based on your individual health factors. Do not discontinue use without consulting your healthcare provider. Possible side effects. Common side effects include dizziness, headaches, nausea, vomiting, and gastrointestinal issues such as diarrhea and constipation. If any side effects become severe or persistent, it is essential to seek medical advice. Precautions and warnings. Before starting treatment, inform your doctor about any existing medical conditions, such as kidney or liver disease, diabetes, or heart problems. This medication is not recommended for pregnant or breastfeeding women, and caution is advised for patients with a history of low blood pressure or electrolyte imbalances. FAQs. 1. Can this medication be used in children? No, it is not recommended for those under 18. 2. Is it safe during pregnancy? No, it is not advised for pregnant women. 3. What precautions are necessary? Patients should inform their doctor of any allergies or pre-existing conditions. 4. Can it cause constipation? Yes, constipation is a potential side effect. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is valuable to us.